Thank you so much for taking the time to join us on this webinar. And I'm excited to be here. I think some of my team members from CYN are also on today's webinar. And so if they just want to say hi in the chat box, that would be great. So you can see him. I see Alejandro from our college program team is here, and Caitlin as well, who's in charge of all of our awesome digital media and outreach. And then also joined by Jocelyn, who is the lead of working on Great American Smokeout this year. So if you all have received your boxes or materials for the Great American Smokeout, I just want to give a shout out to Jocelyn for being the one to organize that and do all of that work behind the scene. And then also our colleague, Vicky, and I don't know if Ignacio is here, but there he is here. So great, awesome team that I get the privilege of working with, and hopefully you all do too if you are doing work with young people to address commercial tobacco here in California. So I just wanted to start off. I'm Kim Homer-Vagadori, and I'm the project director with CYN. I've been working on this issue for a very long time, and just am obviously very passionate about the work that we do, and feel like it's even more critical today as we've been seeing a shift in how young people are using these different products. And that's what we're going to be talking about today. So before I jump into any of that, I do just want to introduce you to the work that we do at CYAN, or the California Youth Advocacy Network. If you are have not worked with us in the past, we are a statewide agency that is funded through the California Tobacco Control Program, which is housed at the Department of Public Health. We also have some funding from the Orange County Department of Education to do a little work with K-12 schools and TUPE programs. But really what the heart of our work is to ensure that young people are engaged in the policy and systems change work that we are doing in tobacco control to denormalize the use of tobacco and nicotine products. And so we really do that by making sure that all of our adult partners have the capacity to authentically engage young people in that advocacy and systems change work. We get the opportunity to do our own direct work with colleges and universities and support what you all, for those of you who are working directly with colleges and universities, have the capacity and the support to advocate for smoke and tobacco-free policies. And also, more so, we've been doing a lot of work around compliance and supporting tobacco treatment and what that looks like. And then we also have a lot of conversations with young people to understand what products they're using, what they think about these products, and what are messages that would either prevent initiation or may motivate them to quit. And so I'll be talking actually about some of those messages today, not going too much into that because we are going to be starting to do some new focus groups within hopefully the next month or so, and we'll be sharing all of those findings a few months out from now. So I don't want to go into too much of the data that we've had in the past, but if you're interested in hearing about those data, we do have some webinar recordings that we have on our website that you can check out. So before I jump into the content, I do want to point out that we're hosting this webinar to really go hand in hand with the Great American Smokeout, which is next Thursday. It falls on the third Thursday of every year of November. This is an event that was started by the American Cancer Society and continues today. And this is an event that our team has been supporting on college and university campuses for a number of years. And we're really excited to be able to offer an assortment of tools and resources so that those of you who either are a community partner working with a campus, or if you are from a college or university campus, that you just have the support to utilize this day and to educate students just on the dangers of tobacco use, as well as to share free resources with them that would hopefully motivate their quitting. And since we're focusing on quitting tobacco products this month, we really wanted to have this webinar to talk about what does it look like for young adults specifically when we're trying to support them in quitting, because young adults do have a different quit behavior, as do young people, youth specifically, than adult population. So it's really important for us to understand that. So before I jump into the content, I did just want to give a little shout out again to our team at CYN who worked to count all of these materials that we distributed. We sent out close to 5,000 quick kits to 64 colleges and universities here in California, and we distributed 84 boxes of these quick kits. So this year we sent out English language, Spanish language, and also quick kits that are specifically designed for student veterans. So this was our team last week putting everything together. We realized those darn toothpicks are a lot to count out, but we also know that they're a useful tool. So we hope if you are somebody who got these boxes from us that they're useful for you and that the young people that you work with are able to utilize them to support them in their quit attempts. So what we're going to be going over today is we're going to be talking about treatment specifically and why it's so critical that we have conversations around tobacco cessation. So oftentimes we talk a lot about policy. We are the field of it's now called the Endgame campaign here in California, but the field that we're in our tobacco control, the effort to end the burden of commercial tobacco in California really focuses on changing systems and changing policies and our environment so that we don't normalize the use of tobacco or normalize the use of vaping devices. And so with those conversations, sometimes we don't talk a lot about cessation. I think, fortunately, as a field, we are now trending more to have conversations about treatment. I'm going to talk about why today is actually a really critical time to have those conversations. But just overall, when we're looking at youth and young adult behavior, why is it important to really talk to young people about quitting? Through that, I'm also going to just briefly highlight what current tobacco use behavior looks like. I'm not going to go into this. I could actually have a whole other talk on youth and young adult tobacco use behavior, and our team is planning on doing that in January once the state of California releases their new data. But today I'm going to be highlighting young adult tobacco use behavior at the national level. And then we'll talk about what are the best practices for treatment. And this is really from the lens of something that we can all be doing. You do not necessarily need to have an enormous amount of funding to be able to motivate quit attempts and to support individuals in quitting. Of course, if you do have funding and staff capacity and resources to do that, then you can have your own tobacco treatment programs. And our team in the past has done in-person full-day trainings on this and hope to be able to do that again soon. But what I really want to talk about is what is the best practices right now that we can embrace to support college students and young adults in quitting tobacco. So to kind of frame up why we need to talk about treatment, I'm going to highlight some of the mental health realities that we have right now with students, the prevalence rates that we're seeing. We really can't talk about what's happening with young adults using tobacco without really recognizing youth, especially because youth today will be a potential college student within the next few years, if not next year. So it's really important that we understand what's happening within the youth community. And then talking about how vaping and other combustible products have been renormalized within society, but the role that policy has on creating that change. So it's important that we talk about mental health. I want to preface this to say that we're hearing a lot more about youth and young adult and student mental health now coming out of the pandemic because of the pandemic. But it's really important to note that youth and young adult mental health was actually worsening prior to the COVID-19 pandemic. And so we see that mental health has been worsening since 2009. And among high school students, that there's been an increase in feelings of sadness and hopelessness. And then among 10 to 24-year-olds, there's been a pretty significant increase in suicidal behavior. And unfortunately, in 2018, it was the second leading cause of death among youth and young adults. And so coming out of the pandemic, and I do want to recognize COVID is still very much present and still here, but for a lot of people, our behaviors have returned back to what they looked like prior to COVID. College students are back on campus and back living on campus and back to socializing the way that they may have been socializing prior to the pandemic. So when we talk about the pandemic, I just want to recognize I'm really looking at those 2 years when society kind of shifted and we changed things. And so during that time, there was a massive disruption to all of our lives, but specifically for youth and young adults who were in a school environment and then all of a sudden they weren't. All of a sudden they were learning online and their social spaces completely dramatically changed. For college students, many of them had to return to home. They moved back home and they did much of a whole year, if not 2 years online instead of being on a college environment. We also know that young people who are disproportionately impacted by other issues, public health issues, racism, all sorts of issues. So marginalized youth and young adults were disproportionately impacted by the pandemic, and not just youth, but also young adults and adults as well. And so that we know that during the pandemic, that about 50% of young adults did report that they had a mental health symptom during that time. The challenge is that only a third of those young people actually had access to get care. So we know that the access to mental health care is difficult. We are still kind of, as a society, working to not stigmatize people who experience a mental health condition and to provide adequate treatment that's affordable and accessible. And so when we look at college campuses as being a space for students to actually get that care, and then we remove those students from the space, it can have a negative impact on those students. And so with mental health, we did hear that from the Surgeon General that we have a mental health epidemic among youth and young adults. But we also have, in 2018, a vaping epidemic among young adults and among youth specifically. And so with that, I do want to recognize that at one point, we really put a lot of the blame on one company for this epidemic. I think it's pretty safe to recognize that Juul was really leading the effort in the promotion of their product. They also created a new, smaller device, which had a smaller battery pack. It had these pod-based products that were flavored. They also are the company that introduced a nicotine salt solution. And since that time, we've seen almost all devices now switch from a free-based nicotine solution over to this nicotine salt solution. There's a new study that was just released that came out earlier this week, and it was all on nicotine salts. And it's really important to read. I'm happy if you want to email me, I can pass it along to you. But what it basically said is that we really need to look back at this new nicotine salt-based solution in these vaping devices that's directly linked to an increase not only in youth use and young adult use of vaping devices, but also the higher rates of addiction. What we know about these nicotine salt solutions is that they are easier to use. Individuals who use them do not get the harsh throat hit that you get when you're vaping a free-based nicotine, which means you can vape more often and inhale more aerosol and nicotine solution without getting that negative body response. And as a result, then we also have higher concentrations of nicotine that are easier to tolerate. The more we ingest nicotine, the more likely individuals are to get addicted. And so when we look at the data from the National Youth Tobacco Survey, this is high school age students. This was recently released from the Centers for Disease Control, and they've yet to release all of the data on tobacco use among teens, but they did release the vaping data. And what they found was that we obviously peaked in 2019 with the highest rate of use among teens with vaping devices. I just want to note this is past 30-day use, so that can be classified as current use. And with that, we had more than 1 in 4 adolescents who reported current vaping, which is extraordinarily high. And you can even look backwards at the amount of cigarette smoking that we've had, which didn't reach that peak of close to 28%. So in 2020 and 2021, we saw that drop in prevalence. I do want to state that the 2021 data, I included it in here, so as a visual learner, you could see if that's also how you how you learn new information. But one thing to note is that that survey was done differently because of the pandemic. So we can't necessarily compare it to the other years. But if we do look at those numbers, it represents there's a decrease in youth vaping. But in 2022, we saw another increase. So we're really watching to see that. I'm not going to share the slides on this today, but what we know with youth behavior specifically is when they looked at, there was a study that was published last year that looked at youth vaping among students who attended school virtually, hybrid, or in person. And students who attended school hybrid had about a 9% vaping rate compared to students who attended in person, which was close to 25%. So we know that vaping and the use of other tobacco products is very much a social thing among young people. And so when young people were home and they were not at a K-12 campus or on a college campus, their behavior may have changed because of that shift on where they were at and who they were with. And so now as students are back on campuses, we really have to watch to see how tobacco use behavior changes. So we can look at that when we talk about young adults and specifically college students. So the Centers for Disease Control recently released their Monitoring the Future data, and it's a fantastic data set where they look both at young adults who are in college and young adults who are not in college. In 2019, we saw for the first time since I've been in this field, where the use of a type of tobacco product, so in this case, vaping nicotine, among college students surpassed young adults who are not in college. So we saw an increase at that time from 6.1% to 15.5% of young adults in college reported vaping a nicotine device compared to 12.5% of young adults not in college. Now, I want to also note with this that I'm not going to share any of the marijuana data, but a similar increase was noted among young adult college students and vaping of THC solutions. We know that this is a big issue. A lot of college campuses are dealing with young adults who are using a marijuana product, THC device, and there's also some co-use there with tobacco and other products, which I'll mention in a minute. So what's interesting with this is these are the data from 2019, and with the report that just came out, they found that now we've gone back to where young adults not in college are back to having a higher rate of vaping than those who are college students. However, one thing to pay attention to with this chart, there's a couple of things, outliers that I find to be fascinating. So the first is that young adults not in college continue to see an increase between 2019 and 2021. And those in college had that dip in 2020. Now, so what's different is for college students, again, we have to look at how the pandemic may have disrupted the normal life of these young people. So for a young adult who is on a college campus, if they were living away from college or at college, they may have had to come home and live with their parents. There's a possibility that their whole social experience dramatically shifted because they were back at home, or because their friends went back to their hometowns and they were no longer living in the college community. And then they also were not going to that space to learn every day. They were not going to a college campus. Whereas with a young adult not in college, they may not have seen the same kind of shifts that then impacted their use. The other thing to pay attention to is the fact that we saw that dip in 2020, and then we saw that increase again in 2021. So what that shows us is that we know that the pandemic did impact use. Obviously, individuals who are experimenting with or have not become addicted with these products or to these products yet may have had a different response. We do know that students who were addicted to a tobacco product prior to the pandemic actually were more likely to increase use because of the stress associated with the pandemic. So another interesting thing with these new data from CDC was we now see a higher rate of use among females compared to males. And that's fascinating because that's only actually happening with vaping devices. With other tobacco products, that's not the case. Male young adults and male college students specifically are still using smokeless tobacco products, hookah tobacco products, little cigars and cigarillos and cigarettes at higher rates than women. But women are using vaping devices now higher than men. So one thing that I think, again, I find interesting as somebody who's worked with this population for a long time is that we know that in the past, attending a college or university campus was actually a protective factor from smoking cigarettes. And so that's not the case anymore. We now have to look at the reality that young adults who are in college, that does not necessarily prevent them from using these different products. There's a lot of reasons for that. However, I know that we're doing the work to try to address that by working on smoke and tobacco-free policies and a lot of the things that you all are doing to really promote tobacco treatment services and do education. But there has been a shift now where we see college students, similar to young adults not in college, as being a population we really need to work with to prevent continued use of the products as well as to support quit attempts. And so now looking at cigarette smoking. So I just had talked about, historically, we know that college students have had significantly lower rates of cigarette smoking compared to non-college young adults. This is the data set to show you that. So the red line shows cigarette smoking specifically among young adults that did not go to college, and the blue line, young adults that did go to college. So the concerning data here is the fact that we actually saw an increase in cigarette smoking from 2020 to 2021. Now, again, unfortunately, this is not terribly surprising considering there's a pretty significant amount of data that tells us that young people who experiment with vaping are more likely to go on to use combustible tobacco products or other like smokeless or hookah products compared to young people who do not vape. And we also know that young people who vape are generally not the demographic of students who would smoke cigarettes. So now we have a whole population of young people who usually would not be at a higher risk for smoking cigarettes. They start vaping, and then their likelihood of becoming a cigarette smoker then grows from there. The good news, though, with college students specifically, is that we know that their rates of use of other tobacco products has decreased. So we saw a pretty significant decrease in hookah use, which is very great, very important. However, I would challenge us all to keep an eye on that because of new state law that bans the sale of flavored products. Hookah is exempted from that law. And so we may see more hookah lounges popping up. And we know from some great research out of Stanford that many of the hookah shops here in California are within just a mile or two of a college or university campus. So something to pay attention to. But we did see a drop in use of small cigars and snus products, which is a smokeless tobacco product. One of the things that if we were to separate out this data, we also see that rates among college students with each of these three products is lower than the use of these tobacco products from young adults not in college. So one thing that is unique to college students is students tend to have higher rates of alcohol use. And we know that use of alcohol and tobacco goes hand in hand. There's some belief among researchers who study these substances that alcohol may lower the inhibition of students, and they may be more willing to try smoking or vaping or even the use of marijuana. And we also know that students who started to use marijuana as a teen are more likely to go on to adult use, either young adult use and then beyond young adult years to using marijuana. So the trick that we're always looking at is what starts first. Does the alcohol use start first and then that leads to tobacco and marijuana use? Do individuals start vaping first and then go on to use marijuana, vice versa? There's studies that kind of point to both things, but what we know is that there is a lot of dual use and poly use, which then is a tricky piece for those of you who provide tobacco treatment to students is how do you do that? Do you just address tobacco use or do you also address marijuana and address alcohol? And what does that look like? And what the recommendation is from the research is that we address all the substances collectively really. But that's hard to do, especially when we look at alcohol and marijuana more as a responsible youth use issue, and tobacco, we really focus on quitting it altogether. So that's something our team is actually really interested in exploring, and hopefully we'll have an opportunity to do so in the next year or so. So as we get back to why are we talking about tobacco treatment, why is this so important? We have to recognize that here in California, we have really renormalized the use of vaping devices, smoking, and the use of tobacco. There's a couple of reasons for this. One is that we now have legalized marijuana. And so we see a lot more people smoking and vaping. And it doesn't necessarily matter what people are smoking or vaping, simply the act of seeing individuals smoking and vaping, when we see it, it becomes more normalized. It feels like everybody around us is doing that. This is a consistent problem that we have within the college population, is that when we when there's been studies with college students specifically, they ask, who uses these different products, tobacco, vaping, and it's usually, like a 1 out of, well, actually rates are higher. The current use among college students is about 26% of college students at the national level report daily use of e-cigarettes. So it's pretty high. But with that, when students are asked how many of your peers are vaping or smoking, the number is actually reversed. So they tend to think that the majority of their peers are vaping or smoking, when in reality, it's not the majority. So this is where a lot of social norming campaigns come around. They're used a lot with alcohol prevention to let young people know that the majority of individuals are actually not smoking, actually not vaping or using alcohol. But the more we see it, the more it feels like everybody is doing it. We also see a lot of aggressive advertising and marketing. We see this from vaping companies, not only the larger industry itself, but also from smaller vape shops that exist within our communities. We know that tobacco companies, and we know Juul, they're in a lot of lawsuits right now, where they are being held responsible for the fact that they had social influencers that were online who were using the products and promoting these products. And then of course, we know that there's also different regulation around the location of retailers for marijuana dispensaries and the advertising and marketing that also comes from those products. The other reason that we're talking about treatment is because you all have been very successful in working towards smoke and tobacco-free policies on college and university campuses. So back in 2008, we had about 75 colleges and universities in the country that were smoke and tobacco-free. And today, just these data are from earlier this year, we had over 2,600 colleges that are smoke-free, and close to 2,200 that were entirely smoke and tobacco free. So that work has really progressed at the national level. Here in California, these are data from our report card that we released in May, that 70% of public colleges and universities in California are smoke and tobacco free. So that is really exciting news to see that shift and that change. And this is up from when we started, well, we started our college work back in 1998, but when we started to track policies was really more comprehensive in 2008. So 5% in 2008 to 70% in 2022. And this year, we started to track policies at private colleges and universities. And so what we found there was that in total, between all of our public institutions and our private institutions, there's about 59% of schools that are smoke and tobacco free. Now, obviously, the work that we've been doing at CYN and a lot of the work that you all have been doing is really focused on public colleges and universities. There's a number of reasons for why that is, and I'm happy to talk offline of why that has been a focus. But we do see that public campuses have been more successful in going smoke and tobacco free than private schools, and that's really where we're looking forward to working next and to supporting those schools and new policies. So as I previously mentioned, and maybe you were watching the news last night and this morning to hear that California voters did pass with a majority vote, Proposition 31. This is the proposition that was actually put on the ballot by the tobacco industry. In 2020, the legislature passed and the governor signed Senate Bill 793. This bill bans the sale of most, but not all, flavored tobacco products in California. It does ban the sale of all flavored nicotine products, not the devices themselves, unless they're the disposable devices that are already flavored, but any of the solutions that are flavored, so the no flavored pods, e-solutions, and then again, of course, those disposables, if they're one unit and they're flavored, they can no longer be sold in California. It also bans the sale of mentholated cigarettes, any flavored smokeless tobacco product, little cigar, cigarillo. So the exemptions are hookah. So hookah was exempted from this state law and can still be sold in California after this is implemented, unless there's local policy that's stronger than state law. It also exempted roll your own tobacco, and then the larger luxury cigars that can continue to be sold with flavors. So this is big news. This is big for our state, and it will be really interesting to see how this impacts young adult and youth use. So kind of just to close out, why are we talking about treatment? It's important for us to recognize that we do a lot of this policy work on college and university campuses. We do this work in local jurisdictions. The work has been done at the statewide level, as evidenced by what happened last night. And we know that policies do not force individuals to quit using tobacco and nicotine products, but we do know that when we make it harder for people to smoke or to use tobacco in specific spaces, or we make it difficult for them to purchase products, or products are more expensive, that individuals are then more likely to quit. And the impact of that is that we also decrease tobacco use, we remove tobacco products from our environment, and we also are getting rid of the waste that comes from all of these different devices and products. And so with that, we see a pretty big increase in quit attempts. And so that's something that we definitely have to be paying attention to now that Prop 31 or SB 793, we look back to the Senate bill, goes into effect, which I understand. I just was talking to somebody about that today, that it looks like it will be implemented 5 days after the election has been certified, which could be most likely in mid-December. So as we prepare for the implementation of this new flavor ban at the state level, it provides us an opportunity, and college campuses specifically, where there are large quantities of young adults, an opportunity to really support young adults, students, as well as faculty and staff, in quitting. And this could be the thing that motivates them to quit their tobacco or nicotine product. If they're using a flavored device, then it's something that maybe now that it's not flavored anymore, they may be motivated to quit. So what we know about quitting is quitting tobacco and nicotine is very, very hard. So nicotine addiction is complex, and we know there's actually different estimates on the number of times it takes an individual to try before they're successful in quitting. But we went with the CDC research, and what they found is that an individual who is addicted to tobacco, it may take them 8 to 11 attempts to quit before they're successful. So we never tell anybody who's making quit attempts about that, because it might make somebody think, why am I going to try if it's going to be this hard to quit? But what we let people know is that relapse is completely normal. And if they try and they're not successful, that they learned something during that quit attempt that they can then use for the next time. And the more you try, the more successful you are at quitting the next time. And so when we talk about the complexity of nicotine addiction, there's a few things that we look at. And I just want to recognize that this information that we have is from our partner, Gary Tedeschi, who's at Kick It California, who we've had an opportunity to do a number of trainings with. And I think that this is a beautiful picture to really identify why quitting nicotine and tobacco products is so difficult. So the first thing is that we're not just quitting one thing, right? So when we are using these products, there's a physical dependency. And so there's actually a physical need from the body and the brain for nicotine. We know that nicotine changes the brain and creates a dependency among the individual who is using the product. This is really critical with young people, which is why 99% of people who ever use a tobacco product start before the age of 25, before the brain is fully developed, because this is when that physical dependency sets in. We also know that there's behavioral dependency. And so this is something where we usually think of this as a habit. We just get into doing something. So we wake up and we start to use tobacco, we vape. That's also directly associated with that physical dependency too, of the body needed that nicotine. But we have learned behaviors. So we all have learned behaviors that are directly connected to other things. You might like to drink a cup of coffee when you're in the car. For a lot of people, they might drink a cup of coffee and have a cigarette, or they might vape. They might, for college students, associate drinking alcohol with vaping. So there's this behavioral dependency. If I do this, then I need to be able to do this. So we have to change that and break that habit. There's also the psychological dependency. And so it's us saying to ourselves like, oh, well, I vape, that is how I identify myself, or I use tobacco products, that's how I identify, or I really enjoy this and I don't need to quit, or I can't quit. I've tried and it's just too hard. So it's the mental side of really thinking of how do I do this, or can I do this, or do I even want to do this? And then there's the environmental factors that are associated with this. So again, in a college community, it's really challenging if there is a connection between parties or social spaces, drinking, and then we add in tobacco. And so you have to sometimes remove yourself from those spaces in order to change your behavior. And that's a big thing to kind of give away, is if you're removing yourself from your peer group, from your social setting, so that you can change your behavior. And then of course, college and university campuses and the communities that they exist in also have a lot of advertising and marketing. We're dealing with issues right now with some of our campuses where we have companies that are coming to campus and delivering tobacco products. So there's constantly a lot of advertising and marketing that these young people are exposed to. But the good news is that we know, at least for adult tobacco users, and I'll talk about young adults specifically in a second, but with adult tobacco users, we know the majority of individuals who are addicted to nicotine, they do want to quit. And we also know that people have been successfully quitting tobacco and nicotine products for decades. And yes, it's hard. It's very, very challenging to do. However, there are a lot of best practices on how to quit, and I'm going to jump into what that looks like. But before I do want to mention and call out the college community and young adults specifically, and note that the challenge that we have is that something that might be a motivating factor for an adult to quit is that they experience a negative aspect of smoking or vaping. So for example, they get a bad cough. It costs too much money for them. They have a health condition and an employee or a doctor told them that they should quit. So with young people, and especially young people who are vaping, they may not be experiencing these negative impacts yet, so may not have that as a motivating factor for quitting. So in the recent National College Health Assessment, they asked college students who use tobacco if they've had a negative impact, and 81% of students said, nope, there's really nothing negative about using these different tobacco or vaping devices. We also look at young adults and ask them, do you have people in your life who are telling you to quit? So again, thinking about older adults who might have kids or grandkids who are encouraging them to quit, supporting them in quitting. For college students, 77% of them said, nope, I don't have anybody in my life who is telling me to quit. That could be, again, they may be living away from home. Their families don't know, they could be hiding their use. It could be that they're in social spaces where use has become normalized. Or it could also just be that in general, people don't think that vaping is as harmful as other tobacco product use. And so there's just not people making that attempt to motivate them to quit. And then we know from, again, this sample of college students that these young people just might not even be trying to quit. So 72% of the sample said, yeah, I haven't even tried to quit. So looking back at the previous slide I shared, where a lot of adult tobacco users are motivated, not so much motivated, but are interested in quitting, we don't see the same thing happening with young adults and young adults in college. And so with that, there's some reasons why. One is that individuals might not see themselves as being a tobacco user. They might not use tobacco products daily. A recent study that came out found that about 26%, I just mentioned this earlier, of individuals who report tobacco use said that they use it daily. So for individuals who use tobacco socially, they don't use it on a daily basis, they might not think that their tobacco use is a problem, and therefore they might not be motivated to quit. The other thing we hear very commonly in college communities is I'll quit when. I'll quit when I graduate. I'll quit when I get married. I'll quit when I get a job. So there's all of these stipulations of when they will quit. The hard part is that it gets harder to quit the longer you use these different products. We also know that young people, both youth and young adults, when they are going to make a quit attempt, they are the least likely of any age group to actually get support. So that makes it very tricky for us who are the ones providing that support when they're telling us, nope, I'm not going to go to a group. I'm probably not going to use medication or nicotine replacement therapy. And I really just don't want anybody to know that I'm even trying to quit using these products. So a lot of the best practices we have to support quitting, they don't necessarily work with young people. The good news is that young adults, if they make a quit attempt, they are more successful in quitting than any age group population. So this is a really critical time for us to try to support and motivate young people in making that quit attempt. So there was a study that came out recently, and this study really only looked back. They did a systematic review of smoking cessation intervention. So I want to note that this did not look at vaping, it only looked at smoking cigarettes and treating smoking of cigarettes. But what they looked at is what is it that works best among young adults? So what they found is the top three things was, one was remote intervention. So the use of the web-based programming, phone counseling, and text intervention. So fortunately, there's a lot of really good programming out there, which I'll share in a bit. Also the use of gamification. So young adults who were involved in programs like a Quit and Win Challenge were more motivated to try quitting. And then the last thing, and I talked about this earlier, was being inclusive with doing multiple behavior change initiatives or intervention. So instead of just talking about tobacco use or quitting smoking or quitting vaping, looking at other substances, looking at alcohol behavior, looking at marijuana use, and even linking in behavioral health services and trying to connect in how do we treat a behavioral health condition, especially since we know a lot of individuals, both youth, young adults, and adults who have a behavioral health condition are more likely to use tobacco or to vape. And a lot of that is also associated with self-medication. So how do we support quit attempts? The first thing I would say is we really have to look at behavior. And this is where our jobs get really tricky with language and with what we're sharing. Everything that we promote to get out there is how are we messaging things? Are we really talking about smoking cessation? That language is really going to connect us into somebody who is smoking and who knows what that word means, and they think that they need to quit. And so in that case, we are kind of eliminating individuals who are vaping or using other products. We're eliminating individuals who don't self-identify as being addicted, and we're eliminating individuals who might not think that they are addicted at all. And so we have to look at who are we trying to reach? Are we trying to reach individuals who maybe are experimenting but addiction has not yet set in? Individuals who use a tobacco or nicotine product but maybe not daily, those who are daily users, which says, again, high level of addiction, and individuals maybe who are using a vaping product and a cigarette, or hookah and vaping, or other substances in addition to tobacco. So who are we trying to reach is really going to then depend on the messaging that we use and what we are offering them, what kind of support we are offering them. We also, again, I just mentioned sharing the correct terminology. So what language are we sharing? What are we getting out there? So this is actually something that our team is always really interested in understanding the terminology that youth and young adults are using when they're talking about these different products. Some things that, for example, that also change is that we're now hearing when we talk about smoking, that young people may not just associate smoking with smoking cigarettes, but also smoking weed. So what is it that we're saying, and how are we putting this out there? Caitlin, my colleague who's on the call today, will be asking these questions of young people that are participating in the focus groups once we kick those off. And then the last thing that we have to look at is we have to think about, what are we asking the people that we're reaching out to do? So are we trying to get information out to young adults to intervene and try to prevent either initiation or prevent ongoing use? Are we trying to get out there to motivate quit attempts? Or are we trying to support them in quitting? Where are they at? And so with that, we look at the stages of change. Now, this is a critical theory that we use to support people in quitting. I'm going to go through and briefly talk about how we can utilize each of these stages to support young adults. But where we start off is that pre-contemplation. So if we're talking about a student who is a tobacco user, if they're in that pre-contemplation stage, they have no intention of changing their behavior. They're not even thinking about it. They don't want to talk about it. We hand them information on free resources, and they'll probably throw it away because they're not even thinking about that. With contemplation, they may be aware that their tobacco and nicotine use is a problem, but they're not really ready to do anything yet. But with preparation, they're aware that this is a problem. And now they know that, yeah, I'm ready to quit. I think I might want to try to quit. And that action piece is when they then start that process. They start, either they start to quit by either decreasing use, or they quit altogether. And again, we see different ways that people quit, and there's really no one way that everybody quits. So it's really best to support each individual. Then that next stage is that maintenance. And so somebody has changed their behavior, they have quit using these products, and now it's helping them change their behavior, again, changing their environments, changing those behavioral habits to support them in staying quit. And then the last stage, which is not uncommon, and it kind of restarts the cycle again, is that relapse. So we know that it's not uncommon for people who try to quit and then they relapse, and that is normal. And that is something that we help tobacco users understand, that it's normal, and we can support them to go back through this cycle. And so with that, I just want to highlight and kind of end looking at, what are these best practices? So we know that the best practices at the national level, and these have also been embraced by the American College Health Association. The first is medical. So we know that anybody who works in a medical space, they should be screening for tobacco use. And not only asking about tobacco use, but then encouraging quitting, and then doing a referral to treatment. So this is what we call a brief intervention, or ask, advise, refer. So this is pretty important for us all to be doing if we have interaction, especially in a medical space with young adults, to ask about tobacco use, all of these different products. If they identify any use, to let them know that quitting is one of the best things they can do, encourage them to quit, and then offer the free resources that exist there. So this is what I just talked about, asking that question, advising to quit, and then referring when they are ready to support them in quitting. The next piece is counseling. So again, this is really tricky with young adults because we know that they don't generally like counseling, but there are now different ways to get counseling. So we talked about web-based interventions. There's phone counseling from Kick It California. There's text counseling for Kick It California and other organizations and websites, web-based. And then of course, individual, group, and then there's also peer programs. Our partners at UC Santa Barbara have a long history of providing peer groups, which have been really effective. You can do individual counseling, which is a really effective way, as well as supporting quit attempts. We know that the actual best practice is to combine the counseling with medication, so doing it collectively. The challenge with young adults is they may not be open to using medication, but if they are, there's nicotine replacement therapy, as well as prescription medication that can help somebody quit smoking and vaping. And then finally, the use of motivational interviewing is a fantastic tool to just get students to think about their tobacco use behavior, and to get them from that place of having absolutely no interest in quitting to that place of maybe contemplating that quit attempt, or even connecting them in to prepare for quitting. So just some tips when we look at the stages of change. If you're working with students who are in that pre-contemplation space or in the contemplation, start to talk to students and find out what are things that would maybe motivate them to quit. So you don't need to come to them and say, hey, we're going to tell you to quit and you need to quit right now, but really just having conversations to say like, hey, what are things that you care about? And is there anything that might motivate you to quit? Is there anything that could contribute to support you in quitting? Or why do you use tobacco? Why did you start? Why do you continue? What do you enjoy about your tobacco use? And finding out those things. And the great thing with that is once we have those messages, then we can share those messages to help move from that pre-contemplation to the contemplation and then connect into that preparation. Now, the beautiful thing with college and university campuses is there's oftentimes a lot of access to young adults because they're there learning, many they're working, and many are there living. They might live on campus. And so there's an opportunity to do campus tabling events, which Great American Smokeout is great to do. Work and partner with the Student Health Center to ask the question, advice to quit, and refer to services. Also utilizing online spaces and then through partnerships. And so when we look at those best practices that I just mentioned, in these two stages, two of the best things that we can do is utilize those brief interventions and then use motivational interviewing to talk through these conversations that may lead to motivation. So our team did a survey last year to find out more about how COVID was impacting young adult tobacco use and also marijuana use. And we asked individuals who had quit tobacco or were interested in quitting, what were some motivating factors for quitting? And what was interesting is that we found out that EVALI, and EVALI was the acronym, I'm forgetting the exact language for this, but this was the lung condition that came from vaping the illicit THC pens. And a lot of young adults had experienced very serious lung health conditions. There were even a lot of deaths that were associated with this. So seeing that and having that on the news, and the governor also invested a lot of money in doing advertisements around this, really led to a lot of quit attempts. I want to note the difference with what happened there and just general vaping is we saw immediate health outcomes, negative health outcomes because of that. Don't necessarily see that so much with some of this, the vaping, especially these newer devices. There were other health concerns that prompted people to want to quit. Again, this was during the pandemic, so people were saying, yeah, I'm staying with my family, so I can't use tobacco or vape. I'm not around my friends, so I can't use tobacco or vape. It was interesting for us that actually COVID was one of the lower reasons that anyone tried to quit or was interested in quitting, and then cost was right up there. But it's important to find out what people's reasons are. So this is something that Caitlin's been looking into a lot when it comes to mental health and understanding if young people care about how vaping negatively impacts their mental health. So highlighting that information, talking about the cost if that's something that the students that you work with care about. And then the environmental issue is huge. I was actually talking to a colleague of mine from Wisconsin the other day, and we were kind of joking about how we call these products disposables, and yet they're not at all disposables. They're an environmental nightmare. So if you have students that care passionately about the environment, this is a great opportunity to talk about the impact there. Obviously, campuses are great places to utilize spaces by having events, by tabling, partnering with housing, and then just doing outreach on campus to just motivate quit attempts, promote quit attempts, and link into these services. If you're working with students who are at that preparation stage or that action stage, or maybe students who quit completely and then they relapsed, this is a great time for us to really be supporting them in their quit journey by providing encouragement, really talking about what are the benefits of quitting, sharing all of those resources. Again, just because maybe they say that they don't want to use them or they want to quit cold turkey, we can still offer different resources, the web-based resources, the quit kits that hopefully you all have, and then connect them to other things to see if they might be willing to use those. And then just regularly checking in to support them through this quit journey as it's so hard. So this is another campaign that we ran during Mental Health Awareness Month, and now have it as a print campaign. It still can be used digitally, but also have it as posters and flyers and postcards to just highlight the benefits of quitting. So instead of kind of looking at any of the negative aspects of vaping, really turning it around and saying, what do you get from not vaping? How does not vaping benefit your health and your mental health specifically? This is the new campaign that Caitlin just designed for the Great American Smokeout. It's on our website. If you want to pull any of the images from there, you can also reach out and get support from her on any of the placement of this. But this campaign is awesome because it kind of walks students through that process. These are quick tips to support them in quitting if they want to quit this month or if they're preparing to quit after the Great American Smokeout. And then, of course, sharing these resources, sharing quit kits, sharing digital quit kits to just give them tips so that students know, yes, this can be hard, but you can do it. And here are tools to help you be successful in your quit journey. There's all sorts of free resources that are out there. These are the ones that we feature on our website. We have a page that's dedicated just to youth and young adult quitting. The reason we highlight these are because they are apps that are designed for youth and young adults. And the counselors at KKIC California have also been trained to provide treatment services to youth and young adults. And then finally, the last thing that we're all collectively working to do, and voters did last night here in California, is we're working to denormalize tobacco use. And as we have smoke and tobacco-free places, as we limit tobacco advertising, marketing, sales, then we can help people who have quit stay quit, which is very, very important. And then I just want to end by promoting a newish kind of, it's a campaign that is being led. It's a quit program that is being hosted on Instagram. This is currently being run by Pam Ling and her team at UC San Francisco and Hope Lab. And it's a very cool and innovative quit program for 13 to 21-year-olds. It's all done through Instagram. And as young people participate in this research study, then they get surveys that they have to complete along the way, and they can get up to $100 in incentives to thank them for their participation. And so it's a really cool program. If you're interested in sharing this with any of the youth or the students that you work with, if they're between the age of 13 and 21, they're still recruiting individuals for this, and you can get more information at quitthehitca.org. And so that's it. This is my contact information, but again, my team here that I get to work with is on the call too, and you can get anyone's contact information from either of our websites, our cynonline.org website and our college website, caTobaccoFreeColleges.org. And then of course, please visit our website if there's anything that we can share with you through there. If you're holding a Great American Smokeout event, those social media messages as well as the event toolkit are on our website. Just go to the homepage. There's an announcement about it there, and it can click you through to the page with all these resources. So just want to thank you all so much for your time. I am going to now open up for questions. I do see that there's a couple of questions or comments that are in the box that I just want to call out, but if anybody else has any questions, please feel free to unmute yourself or put them in the chat box and we can answer those. And then Jocelyn, if you wouldn't mind dropping the evaluation link, we would love your feedback on the information shared today and hoping that it is useful to you. And I don't know, I know there's a question about whether or not these slides will be shared. So yeah, we're going to, after this webinar, we're going to put the recording onto our website along with the slides, which you can download. But if you have any questions about any of the information that was shared, any of the data, please don't hesitate in reaching out. And then of course, as I mentioned, I kind of scratched the surface today on prevalence data. We're looking forward to sharing a lot more with you probably in January. The date has not yet been set because one of the things we'll be highlighting in the January webinar is the new data coming out from the Department of Public Health, which we believe will be happening next month, but we don't know a date yet. So until we have that, we don't want to confirm a webinar date, but lots more to come on youth and young adult behavior in the new year. So it is 2 o'clock. I want to respect your time. If you have to hop off, thank you so much for coming. Again, please take a minute to complete that survey. If you have any questions, feel free to stay on. And I don't know if you can mute yourself or not, but you can put something in the chat box. If you can unmute yourself, please do, and happy to answer any questions. Thanks so much for coming today.
Kim, I don't think I was in the chat when I sent out the link. It only let me send to the hosts and panelists. I don't know if that's something we can include now. I don't know if you you can insert it into the chat, or if we can send it out.
Let me try. I think I can. So
I think we're just trying to figure out this webinar.
I know.